Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. Today we have a returning guest, Adam Russo, who is an attorney and the co-founder and chief executive officer of the Phia Group. Adam, welcome to the program.
Great to be back, Tom. I'm surprised you wanted me back.
I love you, man. There's nothing like speaking the truth. And I felt the last episode, there was so much passion in your beliefs and your thoughts around what's going on in healthcare. And I felt that there was an interesting event that took place last week. Secretary Kennedy released the HHS assessment on chronic conditions, and I want to get your take on what the assessment said. But it was a very compelling assessment, and there's more to come. The full plan is not going to be released until the end of the summer. But before we get into that, just so the audience knows who you are, tell us a little bit more about your organization so they have some context.
Sure. So I started the Phia Group in my mother's basement back in the year 2000 as a cost containment firm, basically identifying claims that overpaid, shouldn't have been paid, someone else should be paying the claims. And these are claims paid by self-funded health plans, which as I told you last time, over 65% of all employers who offer health insurance to their employees and their family members are self-funded, meaning the claims that are being paid with plan assets. So a combination of worker contributions and employer funds go out, and they use administrators, whether it's Blue Cross, whether it's Cigna, Aetna, private third-party administrators who actually process the claims. So most people aren't even aware of the fact that their healthcare bills are being paid directly from funds collected from their paychecks and their employer. People typically think it's a premium that someone else has the risk on, like an insurance company. But for 2/3 of this country in the private employer healthcare space, the employers are actually taking the risk to pay those actual claims. So we do a lot of analytical research, deep dive from using AI, using different algorithms to identify situations where we feel we can lower the overall cost of claims being paid by these organizations and their health plans, and most importantly, leading to better quality outcomes. And unfortunately, even though we've done our best, I can tell you that the past 25 years, all I've seen is claims skyrocket. The number of people on prescription drugs, particularly since COVID, skyrocket. And there's almost this medicate first, ask questions later mentality that's just pervasive in our healthcare marketplace.
Well, that goes to what we talked about the last episode, in that, in this marketplace, and Secretary Kennedy talks about it as well, maybe not in the exact same terms, but, over the last 30 years, we have a growing, older, aging, sicker population, more patients with chronic conditions today than yesterday. And he's always comparing it to what was in the 60s. And so we have an older, age, or sicker population. We have less doctors and nurses. We have more people with chronic conditions today than yesterday.
Think about it. These older, sicker population, when they were in their teens, when they were kids, they weren't obese. They weren't over-medicated. So if you think about, okay, we got 60-year-olds who 50 years ago weren't on medication, were outside playing, right? There were no iPads. They weren't on medication. They weren't obese. They weren't eating ultra-processed foods. And today, it's a very sick, older population. What in the world is it going to look like 50 years from now if we just keep this process going? So people could disagree on whether or not they like Kennedy, they like some of his beliefs, whether it's on autism, whether it's on vaccines. But in my opinion, something different has to be done, right? I mean, I think it was Albert Einstein, right? His definition of insanity is doing the same thing over and over again, expecting a different result. Well, clearly, we need to change what we're doing. Now, we can argue about that. We can have debates about that. But I'm happy that at least that's the discussion, that something different has to happen. Otherwise, who knows what this country is going to look like in 50 years?
I absolutely agree. And when we, there's the buzzwords are on the hymns floor, if you will, and other conferences is always about transformation. But at the end of the day, what are we transforming? We're still in the old same payer model. We're still, we're just throwing lipstick on a pig, frankly, in my view. And truly transformation, you got to do something different. And then, so when Secretary Kennedy talks about in the assessment, he lists four primary areas of concern that had quote unquote comprehensive critique.
Right,
Poor diet, we talked about that, right? Which leads to obesity, diabetes, and other health issues. Yeah, we all know obesity is the number one chronic condition, which has leads to diabetes and cardio type issues. Environmental toxins,
right.
lack of physical activity, you spoke on, and over medication.
I mean,
Uh,
I'd love to like just give you a couple of examples based on each one, right? So,
Go for it.
and I think I have a pretty unique position. So, not only in addition to being a CEO of a company in the healthcare space who sees millions of claims from all across the country, all ages, all jobs, right, all different professions. We represent everything from school teachers to truck drivers. If you're an employer, you can work with us. So it doesn't matter the type of work. But what I can tell you is from that standpoint, I have one perspective. But then I'm a dad with four kids, and my four children are literally in the age bracket that he's talking about. Right? It's my oldest is 12, my youngest twins are 9, and some of them have all my kids do different things. Some are do a lot more sports and athletic stuff than others. Some of my kids are on medication. Some aren't. Some have anxiety. One has dyslexia. It's I got it all. But where I really think I bring a new perspective is I coach everything. Right now I'm coaching Little League Baseball. I just finished flag football. Over the winter, I coached basketball and then soccer as well. And my two daughters are in competitive cheerleading. So I'm around a lot of kids. And when we talk about the first thing you mentioned was poor diet, I see what these kids eat. My children, one of my blessings is the fact that I'm a first generation in this country, and my mom is from Poland and my dad's from Sicily. When you think of Poland, it isn't like you're thinking of the healthiest foods in the world, right? We're talking kielbasa,
Mhm.
pierogies, like stuffed cabbage, right? But let me tell you something. We go to Poland this past summer, and half the chips, half the candy bars, half the ice cream that my kids eat here in America are literally banned in Poland. Like you can't buy nacho flavored Doritos the way we do at the corner store. Like they have Doritos, but they don't look dark red. There's no like lime green. Like it's just not processed the same way. It doesn't have 75 ingredients. There's 5. And even when they eat food at a restaurant, they don't feel bloated. Like it's just healthier, fresher, not preserved. It's just a total different mindset. And that's why when you walk around Europe, people are thinner. People are walking more. Not everyone is, jumping on the carpool to go to the next practice. And that's another thing you see. As a coach, it's all about practice, play dates. Now it's all about club teams, right? I remember as a kid, you go to the park, 20 kids show up, and you play a game of sandlot baseball. Like that's it. That does not exist now. You don't go to any field and just see random kids bringing their bats and balls and playing a game.
That's
Wiffle
true.
ball, right? Think about it. Everything is structured in a way where you'll have 5 to 10% of the kids that are playing baseball every day, practice games, etc. But that's it. It's such a sit down, play on your iPad, be on your phone. And I just see the lack of physical activity, the amount of prescription drugs that each one of these kids, not all, but so many of them are on meds. I would say at least 50 to 60% of the kids that I coach are on some type of medication they have in their backpack, which to me, as a kid growing up, I don't remember. I remember my best friend Al having an inhaler. I mean, that's as far as it went. And it's just a different world today. And all these things combined, as Kennedy was talking about, definitely have led to just the sickest, most obese, least physically active youth that I think we've probably ever had in the history of this country.
I share your perspective of the past. I grew up and we used to do the same thing. We pick up game of baseball. Left field was out of bounds because we didn't have enough players. Right.
Right,
So and quite frankly, sometimes the police would actually come, not in a negative way, but they'd be the pitcher. Right.
right.
They were just big, friendly, neighborhood stuff. Right. And I didn't live in a rich neighborhood. Right. So I wasn't a rich guy, kid growing up. And neither were my friends, most of them. But so, and when we were in school, gym class was about running, playing soccer, running track, sweating, right? Get a good.
Remember pulling
Yeah,
the rope
exactly.
thing? We had to
Yeah,
climb up to
exactly.
the top.
Exactly. Exactly. But so I get that. So what has to change, right? Because nothing will change. None of these things really are going to be addressed in hardcore, specifically the poor diet and lack of activity. From the last episode, my father was obese, right? And they treated the symptoms far too often, as opposed to telling them, hey, maybe you should lose some weight and be persistent about it, not give up, which is what I think a lot of the providers did. They gave up, but and at the end of the day, as you know, he lost 3 of his limbs and 2 of his fingers because obesity doesn't hurt. So I'm going to keep eating.
Right.
Right.
And eating masks so many other things,
Yeah,
right? Depression, you
exactly.
eat, you feel better, whatever it might be. 100%.
So what do you think we need to do to truly transform the market? Right. We know what the problem is. We know what the history is and we know what's different. But, to me, as an example, the physician fee schedule is going to come out in July.
Yeah.
Right. They're at least the draft. Unless something drastically changes in that physician fee schedule, nothing will change.
Let me give you a good
Because
example
go
on
for it.
that piece, right? So, in regards to all 4 pieces that Kenny was talking about and how you can attack them, a couple I think are much easier than others. Like a good example, the diet, ultra processed foods, which I'm going to combine with the second one where he talks about, the chemicals, pesticides, additives. It's not going to be easy to get children to change the way they eat, right? It's just too easy. Again, as a dad of 4, to go to Chick-fil-A, to go to McDonald's, DoorDash, all this stuff just makes it so much easier to get ultra processed, high fat, bad food. Let's just say I'm busy. I would still have to drive to the McDonald's, wait in the drive-through line, get the bad food, bring it to my kids. You don't have to do that. The technology now has made it's delivered to your door in 30 minutes. So the behavior, I don't even see that changing at all. Especially, I go to, every once in a while, I'll go to Cambridge. I live in Boston, so I go to Cambridge, Mass. And that's where Harvard is. And what you'll notice is you'll see all these, bikes, mopeds, or small cars on the side of the road, double parking, illegally parking, and they all have their hazards on. And I said to my wife, I go, what are these people doing? And she goes, what do you mean? That's DoorDash. I'm like, what? Yeah, those are DoorDash people. Those are workers pulling over, grabbing the food, pulling over, and they're literally delivering food to some college kid who could have walked 30 seconds. That's not going to change. As long as we have more technology where people are going to have less reason to move around, I don't see how that's going to be a quick fix. But changing what's in the food before I call DoorDash or dial on DoorDash and what that food looks like when it's presented to me, that can change. That's where we could take out the additives. We could take out the food colors, right? All these red, whatever it's called. That stuff can be done. Obviously, politicians are going to have to step up, right? They have to, there's so many donors, there's so many lobbyists that are giving money to their campaigns. You have to push against a big machine to change that. But that can be done. And when it comes to physical activity, there's one place where we still control what our kids do, and that's school. We've seen the math scores down. We've seen the reading scores down, comprehension. Most kids, not that they can't read for a long period of time. Why? Mm-hmm. It's all Instagram. It's all quick YouTube videos. It's all, as you know, I'm sure that you would love to have a show for 3 hours. Are you kidding me? You're lucky that 30 minutes is already at the edge of how much time you can actually keep someone's attention for. But what can we do, my friend? In school, prioritize gym class, physical activity. Like, it's not twice a week, it's every single day. It's no different than math, English, history, science. You got gym class, and your gym class isn't the kind where, okay, go stand by the bench, Joey. Yeah, you could just play with you. No,
I know what you're talking
mandatory
about.
running,
Yeah.
right? And so at the end of gym class, you have to take a shower because you're sweating so much. That's what we got to bring back. And I don't think who in the world would be against that. Like, oh, yeah, let's stop. I mean, who wouldn't want their kids to come home from school and actually be exhausted because they had to run for 30 minutes?
It's hard to say. I was on the Board of Education for 14 years, and I know the pushbacks. The pushbacks are, when you have to take a shower, you got to take your clothes off. There's
Issues there.
privacy issues, and there's a lot of issues on that side of the equation, right? Or there's physical reasons why someone can't do. There's 10,000 reasons why. I always say, hey, tell me the reasons as to why we should do something, as opposed to the 10,000 reasons we can't do something, because you're
You could
making
always have an
excuses.
excuse.
You can always have an excuse. They're easy to come by, right?
Right.
But the change is going to be hard, and unfortunately, I think it's going to be. And this is where the political fortitude is going to have to be strong. Even
Yep.
the lobbying side of the equation, right? Fruit Loops was an earlier example of, to your point. Fruit Loops in Canada and Fruit Loops in the U.S. are two different Fruit Loops, because
Right.
one has natural ingredients, the other one is made up of chemicals, right? And so it's just, we have to think differently and we have to act differently if we really want to change.
And there's one more thing. So we talk about, and one of the four tenets that he brings up is the over medicalization, right? Too many prescriptions, too easy. I'm not even going to get to the vaccines. I'm putting that aside. Just prescriptions, right? Now, all this ties in. There's not enough doctors. At least there's not enough primary care doctors. What they're telling us, and this is from the Association of American Medical Colleges, that by the year 2036, there will be a shortfall of up to 50,000 primary care docs. Right now, it's a 20 plus day wait to get an appointment. Your average time with your doctor is about 15 minutes. You're still waiting in the waiting room with a bunch of sick people.
And half of that is with the physician with their heads down, looking at their EHR,
Because
typing into their
because
EHR.
that's the way the system is built, right? It's
Right.
all about speed. It's all about billing. But then look at the price comparison, how much they make. The average primary care physician makes about 250,000. A specialist starts off at about 400,000, 380 to 400,000. You're graduating medical school. You got a lot of debt, I assume, right? That's another thing. How we could actually promote getting more primary care physicians is by covering their debt, right? Paying it. That's, you know what? If you become a primary care specialist and you're willing to work in a rural area and you're willing to work with kids, and we put these plans in effect, we'll take care of your medical debt. That's a big reason why these young doctors are not going into primary care. It's plus the stigma. Oh, you're just a regular, you're taking care of coughs and flu symptoms. It's different than, ooh, you're a brain surgeon. Oh, you're a back specialist. You're a spinal specialist. And that gets into a whole nother world of those docs who are making more money. Guess what? You need to bill. How do you bill? You need more surgeries. It goes into what you talk about your dad, talking about my family. Instead of telling someone, let's find ways to lose weight, we'll just give you a back surgery. You'll be fine in about 3 months. All this works together. But think about how much easier it is. And I experienced it in my own family with my kids. You see a child that maybe has, ADHD, right? Attention deficit disorder. What's the easiest thing to do? Here's some Adderall. All right, next. Get the next person in to come into the room. Now you get your next patient. In a world where so many people have single parent homes, mom works 2 jobs, dad works 3 jobs. There's not time in the day to, sit down with your kid and help them with their homework. Tutoring. It's here's a pill. Your kid will pay more attention. Here's a pill. Your kid's going to behave better. Here's a pill. Your kid will go to sleep at night. It's just constant pill taking, as if this magic drug And trust me, I've been suckered into it. Tom, I've had situations where my wife and I were told by a doctor, well, here's this pill, and I think it'll help her out at school. And you're like, what are you going to say? No? That's the thing. People look at their doctors, and I get why, as almost like the Messiah, right? Like the savior. It's like your doctor tells you, take this pill for the next 5 days, and you're good to go. Put your kid on this medication, and things will be better. You believe them. You want to believe them, even though you don't really know for sure if that doc's thinking, man, if I had an extra 30 minutes with this person, maybe I could get to the root cause of why they have these issues versus trying to give them medication to mask it.
Here's the medication. Come see me in 6 months. Hopefully it works. Yep.
Right.
I'm with you. I'm with you. There's a lot that has to be done. So I am going to, we have about 3-4 minutes left. I'm going to shift conversations here because we have a great announcement in that, as everyone knows, the virtual shift is part of the Healthcare Now radio platform and network. And Adam, you're going to be joining the team as a new radio show host. So congratulations.
Thank you. And
Awesome.
I only have you to blame. Okay, Tom. Tom
This is
brought me
true.
on his show. You brought me on the show, and somebody was listening and that thought that, maybe this guy could be a good host. And, I'm one of those people that if you're going to tell me something nice, you're going to make me feel good about myself. I love when my ego is inflated. It's no problem at all.
Right to
So,
you go.
and, but I'm really excited about it. I truly believe that my experience, like I talked about, being a dad, a coach, a CEO in the medical profession, working with, Dr. McCary, who is part of the whole team on Making America Healthy Again. Dr. McCary, Marty McCary, who's part of the administration, he's a close friend of mine. And it wasn't from lobbying or DC. He's on the circuit. He would speak at conferences like I would speak at conferences. And we ended up speaking at the same conferences, one of us before or after. And so I've gotten to meet a lot of really interesting, really smart people who are trying to change the way healthcare is being delivered, whether it's talking about healthy options, whether it's less medications, to more use of AI and technology to try to get to the root causes of a lot of things. So I'm really hoping to just change, or not even change people's minds, but just give people some new perspective on the way they look at things. And I'm really excited about joining the family at Healthcare Now Radio.
Awesome. And the name of the program?
Health Sense, which is CENTS, like money.
Yep. Awesome.
But at the same time, just not looking at it as, how do we fix this one little problem here and there? But just, if at the end of the day, if we had a clean slate and we said, okay, let's build what we think should be the future of how healthcare should be offered, provided, etc., what would it look like? And being bold and not being afraid to think big, and hopefully some small change will happen over the next few years.
Awesome. Do you have a time slot?
The show's on at 10 a.m., 6 p.m., and then 2 a.m.
Awesome. And that's right before the virtual shift. So people have to allocate 30 an hour of time to listen to Adam first, and then I'll come on right after you.
I am honored to be opening act for you. One day I'll have the main stage, right? One day I'll be like you, Tom. But until then, and it's debuting on June 9th, so I'm really excited.
Awesome.
On the time slots.
Awesome. Hey, congratulations. And the best of luck in the program. You come with such passion, such insights, and thought-provoking ideas on what we really should be considering. To your point, the quote earlier about Einstein, the definition of insanity is doing the same thing over and over again, expecting different results. You have ideas that can change the way in which healthcare is delivered, and I really am excited about you being a host. So congratulations and all the best.
Hey, thank you so much for bringing me back on, and look forward to working together and collaborating even more in the future, my friend.
Awesome. With that, we'll close the show. Have a great day, everybody.
Thanks, Tom.
That's today's shift. I appreciate the audience taking the time to tune in. If you missed part of today's episode, you can tune back in at the healthcarenowradio.com at the same time 11 a.m. or 7 p.m. Eastern throughout the week. And be sure to check out the program page at thevirtualshift.co. As well, remember to follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.